Support for this podcast comes from the Central Valley Journalism Collaborative, connecting communities with the resources, infrastructure, and networks to ensure a vibrant local free press.
From KVPR in Fresno, this is Central Valley Daily. It's Thursday, May 14th. I'm Sarith Hawk. Traffic deaths in the Central Valley related to DUIs happen at a rate more than double the statewide average. A new Fresno State research project aims to find out why.
And so the goal of the data analytics model is to be able to use data from the past combined with other things that we know contribute to alcohol-related fatalities.
Coming up, we speak with one of the people helping lead the project. But first, these headlines. Vice President J.D. Vance announced on Wednesday that $1.3 billion in Medicaid funding to California will be withheld over suspicion of fraud. That's believed to be the largest ever deferral. The new action is part of Vance's anti-fraud task force as the Trump administration expands oversight in federal health programs. States have acknowledged fraud is a legitimate concern, but some have pushed back on the administration's aggressive tactics to address it. Governor Gavin Newsom is disputing the administration's suspicions of fraud against the state. Parent advocates rallied at the state capitol this week with a message for the governor: increase funding for childcare. Cap Radio's Laura Fitzgerald has more.
Mary Linda Bustamante is an advocate for parent voices from Los Angeles. The organization pushes for increased childcare funding at the state level.
And this is so personal to me. I have a daughter, she's 2 years old. Before I was able to get childcare, we were living in a homeless shelter.
Newsom originally committed to funding 200,000 subsidized childcare slots for low-income families. So far, his administration's reached 130,000. Bustamante points out that's 77,000 slots short.
Keep your promise, Governor Newsom. Keep your promise and help our children feel supported and our families to be safe.
The plea for funding comes as private childcare providers struggle to stay open following California's implementation of universal transitional kindergarten. This is Newsom's final year in office. He's scheduled to reveal his final budget proposal called the May Revise this Thursday. In Sacramento, I'm Laura Fitzgerald.
The World Cup is officially 1 month away, and some Southern California advocates aren't happy about how organizers plan to address human rights. Libby Rainey with our newsroom partner, LAist, reports.
A human rights plan is required by FIFA, and it's meant to outline the approach to safeguarding visitors, workers, and locals during the tournament. The guide put out by the host committee, which is led by the Los Angeles Sports and Entertainment Commission, is primarily a guide to already existing laws. Advocates say that plan is lacking. The human rights plan also makes no mention of ICE or what happens if immigration enforcement occurs in or around the tournament.
That was Libby Rainey reporting in LA. Reading scores are declining nationwide. Researchers at Harvard, Stanford, and Dartmouth say most test scores continue a downward trend that started before the COVID-19 pandemic. However, rising scores in a few locations highlight the advantages of some different teaching methods. Districts shifting toward phonics-based instruction show rising scores. Known as the science of reading, it's a phonics-based approach that encourages the sounding out of words. A Fresno County community finally has clean drinking water after a nearly 10-year push. The roughly 40 homes in the unincorporated town of Tombstone Territory now have potable water after being connected to the water system in the nearby city of Sanger. The community has long faced issues of dry wells and contaminated water. Residents relied on bottled water and emergency water tanks.
Have you ever wondered how a local town got its name or why it exists to begin with? That's what we do on KVPR's Central Valley Roots. Dig into local history. Learn something new about your community. Listen to Central Valley Roots wherever you get your podcasts or visit kvpr.org/roots.
And now to our main story. Central California has a DUI problem. The region sees nearly 3 times more DUI-related traffic deaths compared to the statewide average. That's the finding from the Central California Public Health Consortium, a group that brings together county officials to exchange ideas on public health issues. The group recently found that the number of alcohol-related traffic deaths has continued to worsen over the past decade. The research centered on 12 counties in Central California between Kern County and San Joaquin County. But what if you could predict where these accidents are most likely to happen and why? That's what the Fresno State Transportation Institute and the Central California Public Health Consortium hope to find out. Alyssa Kennett is the director of the consortium. She says understanding some key factors could help prevent more deaths in the future.
So we have a lot of data. The data exists to give us information about when and where these kinds of accidents occur. And so we have a lot of information that we can look back on. And that tells us things, but it is not as helpful for helping us prevent accidents unless we start to incorporate some other information that we also have. And so the goal of the data analytics model is to be able to use data from the past combined with other things that we know contribute to alcohol-related fatalities and use that to identify where hotspots are located. Where are these kinds of accidents most likely to happen in the future? When we know that, we can get pretty detailed with what sorts of interventions and strategies we want to try to deploy to prevent them.
That's interesting. So hotspots, what kind of factors would help determine something like that?
Yeah, so at the most basic level, we're looking at where an accident happened. But in addition to that, we can also look at things like the time of day that it happened. Was that resident or that person, people who were involved, were they from the area or not? What were the weather conditions like at the time? What is the condition of that particular road? Was there lighting? Did it happen during the evening or during the daylight? And even time of year. So like there are patterns in times of year as well. And when you layer all of those things on, you get a more complete picture of the why behind the where.
And what kind of work goes into collecting this data? Is it really just looking at, accident reports, or is it more than that?
Yeah, so the data is publicly available. It's not data that we collect ourselves, but it's complicated, and our partners at the Fresno State Transportation Institute are really great at looking at traffic data specifically. And the way that the data is packaged is not super useful most of the time. And so we have to do a lot of work pulling out different kinds of data and layering it on. And, I am not the data expert myself, but our data staff do a really great job of being able to put it together in a way that makes it usable so that you can identify actionable strategies based on all of the information that we already have.
So it's interesting to me that this data hasn't been aggregated before to determine this kind of thing. Why do you think that this is a novelty right now?
It takes time and capacity. Resources are stretched pretty thin. And I think that when you're talking about something like alcohol-related fatalities, the responsibility for that sits in a lot of different places. So you have law enforcement, who is frequently involved in response and then also involved in mitigation efforts. You've got public health sometimes that is involved in education to the public. You might have other organizations that play some kind of role in trying to prevent or respond to these kinds of accidents, but it's not one entity's responsibility to really understand the data from a big picture perspective, from a really high level, right, to paint the picture. And so all these different organizations who are doing incredible work have just a piece of the puzzle. And so really what we're trying to do is to bring all of that together in a way that makes sense, where we can look at Central California and say, like, there's a problem here. And we know that not one organization is going to be able to fix it on their own, but what can we each do in collaboration?
And, through your research over time with this, have you been able to determine why it is that Central California's fatality rates are higher than other regions? We're looking at, in 2023, the region recorded 6.5 deaths per 100,000 people compared to California's overall rate of 2.6 per 100,000.
I wish I had an answer for you that explained exactly why this is happening. We don't fully know yet. We are hoping that by the time we get to the end of developing out this data model, that we will have a clearer idea of at least why it's happening in the hot spots that are identified. I think that, we could hypothesize a lot of reasons why this might be worse in Central California. There are a lot of things that lead up to come before the decision that someone makes to get in their car and drive while intoxicated. And a lot of resources that are missing before a person gets to that point. We're hoping to be able to answer that question more completely by the time we get to the end of this project.
So this sounds like it's a lot of work. And right now, you are working with a small grant of $140,000. What are you hoping will happen with the research grants and everything in the future?
Yeah, so follow-up work is always great, right? Like follow-up funding would be awesome. But really, by the end of this project, what we hope has happened is that we have a tool that can be deployed across any county in our region to help them have just a really good foundational information to be able to develop their own strategies. So we're piloting this collaborative approach across different organizations. We're working on a predictive data model, and we think that these things, in combinations with a couple of pilots that we're rolling out in Kern County and Tuolumne County, could act as education, information, lessons learned for other counties in the region who want to start to take a closer look at this issue.
And why are you focusing specifically on Tuolumne County and Kern County? Can you talk a little bit about that?
Yeah, so those two counties have some of the highest fatality rates in the region, but they're also really eager to get work done. And so that's really important in a partnership, as you want to work with people who are excited about trying to come up with creative solutions. And so that's part of why those two counties have been selected for pilots. We also know, though, that Kern County and Tuolumne County are very different. So Kern County, has rural parts of it for sure.
Yeah.
But is really centered around 99, and at least through the Bakersfield corridor. And it's a different kind of county than Tuolumne. Tuolumne County is mountainous and really rural and has a lot of traffic for Yosemite National Park. And so the kind of travel that happens through those counties is different. And the terrain of those counties are different. The population of those counties are very different. And so the kinds of solutions that those counties may each come up with could and probably should look different for those counties.
Alyssa Kennett, Director of the Central California Public Health Consortium, thanks for your time.
Thank you. It's been great.
And that's today's show. If you enjoyed listening to the podcast, support Central Valley Daily by leaving a 5-star rating in your podcast app. We thank you for your support. Today's episode was produced by Jonathan Linden and KVPR with support from the Central Valley Journalism Collaborative. I'm Sarith Hawk. Find the latest local news anytime at kvpr.org.
Every day on Up First, NPR's Golden Globe-nominated morning news podcast, we bring you 3 essential stories. At the heart of each story are questions. What really happened? What really mattered? What happens next? At NPR, we stand for your right to be curious and to follow the facts. Follow Up First wherever you get your podcasts and start your day knowing what matters and why.